Recognized gentleman from New York, Mr. Collins, 5 minutes for questions.
Thank you, Mr. Chairman, and thank you, Secretary, for being here today. I'm from Western New York, which is a very rural community. We have one of the highest enrollment of Medicare Advantage. I know prior to the Affordable Care Act, I would say that without a doubt, one of the bright spots in the delivery of health care in the United States was Medicare Advantage. Dealt with the donut hole. It was a lot of comfort for the seniors to be able to go in, much like we do with HMOs, and great program. And yet, as was brought out earlier, and I want to get into this, it seems as though the President and the administration and HHS views Medicare Advantage with some level of disdain, in that it's the piece that keeps getting cut. And as I look through some of the data, and I'm kind of a data-driven guy, the interesting thing I found about Medicare Advantage, there's over 7 million enrollees, represents almost 30% of the Medicare population, which would indicate it works. Number two, when you look at who uses it, lower income beneficiaries have a higher enrollment in Medicare Advantage than do wealthier individuals, which means it's serving best some of the lower income populations. We've also seen that when I look at the rural plans, again, in rural America, which I represent, a higher percentage of folks from rural America are using it. So I'm just asking the question and the interesting thing too, the bad information we got today was from AHIB. They said the current 0.9%, the 0.9% cut that's coming now in the subsidy to insurance companies for Medicare Advantage is going to add another $20 a month to beneficiaries, either in higher premiums or reduced benefits. So could you speak to just the opinion of older Americans on Medicare, that they are being used as the funding source for the expansion in Medicaid, and all of those increased costs on the back of our seniors who've depended on this great program for all these years? A frustration level exists within that population.
Appreciate that, and as I responded to your colleague with regard to the issues of Medicare Advantage, I would say we support the program, believe the program is a good program, but also believe that our responsibility where we think there are things that are happening, whether that's upcoding or other things, that we try and take care of that. The changes that we've done, we've tried to transition those changes. We try to do those changes slowly so that we watch and monitor. We've seen an increase in the number of people in Medicare Advantage. We have seen premiums hold steady. We've seen an increase in quality. So the negative impacts that were articulated at the beginning of those proposals, we have not seen. We want to continue to monitor and make sure that we don't see some of the negative impacts that you were talking about. We value the program. We think the changes, they've been recommended by MedPAC and others. We understand the concerns, but trying to operate in a world, and with regard to the other issue that you mentioned, I would just say across the board, and whether it's the issue that your colleague just mentioned with regard to providers or the $780 million we do in discretionary cuts, we try to spread these things across the entire parts of our budget.
But are you aware that there are now over 200 counties in the United States that don't have a Medicare Advantage plan at all to offer their seniors as a direct result of the cuts you've made? So when you say it hasn't had this impact, there's seniors in over 200 counties in the United States that can't even buy the coverage.
So 99% of the nation has coverage in terms of the beneficiaries' accessibility.
But yet the number who don't has increased from 55 counties before the ACA to over 200 today. So there's a direct impact. I mean, the numbers, the data is the data. You can't make it go away.
With regard to those numbers, as I said, I have the number of the current coverage and would want to understand the change over the period.
Yeah, what I'm trying to point out is it has had the reason you're looking for this funding is to pay for the expansion of Medicaid. I mean, whether it's the health insurance tax or the individual mandate or whatever, the big cost driver has been this huge expansion in Medicaid, would be my observation.
what I would observe is some of the comments that have been stated about the question of overall entitlements and the growth. We have a bulge, a population. We have a large group of people who are elderly in Medicare. The Medicare cost, even though we've controlled per capita cost for Medicare over the period of what we're seeing, because more people from the baby boom are retiring and older, that's an issue that we as a nation are going to have to look at and deal with. Medicare costs are going to continue to increase because of volume, even if we can control per capita costs. And so with regard to the questions of what will be costing the nation money over periods of time, the issue of Medicare is one because we're going to have the baby boom and the echo come through, we're going to continue to have to make good on the commitments we've made. And that will cost us, because even if you control it per capita, volume is greater.
Well, thank you for the answer. My time's expired. Yield back.